Today I will talk about oral probiotics. So what is oral probiotics?
I'd like to invite each and everyone to just go to KJR Dental Center YouTube channel, and you may press the subscribe, and you can also hit the bell button for notification. Then you can also like our Facebook page, and you can also share. Now, probiotics in dentistry. This is a very good topic today, as I'd like to tell you that probiotic health is based on FDA regulations, is specific strains for specific illness. So meaning to say, there's an oral probiotics specifically designed for oral cavity. And we know for the fact that live microorganism, probiotics is a live microorganism which when consumed in adequate amount confer a health effect to the host. And there have been a promising area of researches of the use of probiotics for oral health. We have three major problems. Number one is caries. Why we do suffers from caries or patients suffering from caries? Because there have been a breakdown of a resident bacteria. If you do have a resident bacteria, of course, there will be a lot of pathogens that will penetrate and will stuck into this. Number two, we have what we call halitosis. A lot of people are suffering from halitosis. Sometimes their mouth is clean and they are still suffering from this. It might be your gut. So you will also benefit from taking probiotics every day. And the number three and the most common problems of patients today in terms of oral cavity is what we call the gingivitis for pregnant women. And 70% of the research shows that pregnant women really will suffer from gingivitis, usually for first sem and the last trimester of their pregnancy. So I'm talking about the product called ProlacSan. So this ProlacSan has two preparations. Number one is the ProlacSan gel, and number two is ProlacSan tablet. This ProlacSan contains two specific strains for oral cavity. And somewhere these are documented with several studies. And as a matter of fact, there had been a study in Europe period 9. So this was actually conducted last of October 2018, just recently. Probiotics as antimicrobial therapy and periodontal treatment. And this was presented in Amsterdam by Dr. Deschiner, Dr. Kasai, and Dr. Paitina. And all of these three I've grouped this one. This was actually taken, or the study were conducted in Department of Periodontology in University of Germany. Yes, one of the top university. So they have grouped the subjects into three, and they've measured the following details. Number one is they measured the CAL, which is the clinical attachment loss. They also measure the PPD, probing packet depths, and they also measure, the last one is BOP, bleeding on probing. So the study shows that the grouping shows that group number one, these are subjected for just plain and simple oral prophylaxis. Group 2 were subjected for OP, plus this is what they call the photodynamic antibacterial therapy also. And the last one is group number 3, oral prophylaxis with ProlacSan gel and ProlacSan tablet. So let us see the results. The results so stunning. It's so amazing. As you can see in the result, in group 1, which is oral prophylaxis, in CAL, there have been a decrease. So there's an improvement of 0.78 mm. So this is a great improvement. So using Propi only. And there is also improvement on PPD of, again, 0.78 millimeter. And with regards to bleeding on probing, there have been no changes. Let us now proceed with number 2. Oral prophylaxis plus photodynamic. There have been a decrease or improvement of 0.63 mm. PPD is 0.78 mm. And no changes on BOP. This is what I would like really for you to focus on The group 3 has very, very good result. There have been a increase or decrease, or there have been a great improvement of 1 millimeter for clinical attachment loss, and probing on pocket depths, it's 1 mm. That's so significant. And in bleeding on probing, we have the highest reduction of bacteria as compared to other groups. As you can see, there have been an improvement of almost 50% in the first Tannerella, and there have been also a very good improvement on almost 68% in the other bacteria that are present in our gingival pockets. So, we therefore conclude that study shows that an adjunctive ProlacSan treatment improve clinical and microbiological outcome in chronic periodontitis patients, not only short term but also a follow-up of over 6 months.
So that's it. Oral Probiotics, ProlacSan Probiotics, one of the best products available in the country today. Thank you very much. Thank you very much.